This is the skill administering ophthalmic medications. First, start by completing all of the medication guidelines, including the 3 checks against them are. Complete all 6 essential tasks. Identify the patient using 2 forms of identification and educate the patient about the procedure. Assist the patient to a high Fowler's position with the head slightly tilted back. Don clean gloves. Clean the edges of the eyelid from the inner to outer canthus if needed. For instilling eye drops, hold the eyedropper resting the dominant hand on the patient's forehead. With the non-dominant hand, pull the lower lid down to expose the conjunctival sac. Position the eyedropper 1.5 to 2 centimeters above the patient's eye. Do not let the dropper touch the patient's eye. Ask the patient to look up and drop the correct number of drops into the conjunctival sac. Do not drop the drops onto the cornea. Ask the patient to gently close their eyes. If the medication has systemic effects, press against the same side of the nose to close the lacrimal ducts for 1 to 2 minutes. For administering eye ointments, rest the dominant hand with the eye ointment on the patient's forehead. With the non-dominant hand, pull the lower lid down to expose the conjunctival sac. Ask the patient to look up. Apply a thin strip of ointment about 2 to 2.5 centimeters into the conjunctival sac. Twist to break off the strip of ointment. Do not let the tube touch the eye. Ask the patient to gently close their eyes for 2 to 3 minutes and then have them blink several times. Explain to the patient that vision might be blurred for a short amount of time. Document administering the medication and complete your ending 4 tasks.